I'm Natalie. I'm a trainee with the Australasian College of Emergency Medicine and formerly a health advisor on heavy metal poisoning with Médecins Sans Frontières. So you might encounter the occasional case of heavy metal poisoning in the ED from sources such as traditional medicines, foreign body ingestion and occupational exposure. And if we miss these patients, then the sequelae can be quite significant. Also, for most heavy metals, there are effective treatment options, so it's worth identifying these patients early on. The other side to this topic is that it's becoming an increasing public health concern, partly because environmental contamination with heavy metals is increasing due to industrialization, and partly because we're recognizing and thinking about it more. Those exposed both in developing countries and in the West tend to be of a lower socioeconomic group, and therefore arguably heavy metal poisoning is a neglected disease of poverty. I'm going to focus on lead, mercury and arsenic, and this is the pointy end of heavy metal poisoning. This is a little boy that I treated actually in Nigeria with lead encephalopathy from ingesting soil contaminated with lead by artisanal gold mining. Now, kids start with behavioural changes, headache, vomiting, and progress to seizures, status epilepticus, coma, and finally death if not treated. And encephalopathy doesn't usually start until well above 80 micrograms per deciliter, and this little boy was at 244. These are the signs that you might see in an adult or in a child with a lower lead level: peripheral neuropathy, abdominal symptoms, anemia, etc. And these are the subtle subclinical changes that can have a significant impact on a population scale. So if all the patients in an area are subtly lead toxic, like in Zamfara for example, and globally decrease their IQ by 10 points, become less fertile, more violent perhaps, and have physical chronic disease that will reduce their life expectancy, these things can have a major impact over time on a given population's ability to move forward. Dr. Milker, who's a toxicologist from New Orleans, recently published this astonishing data showing the correlation between aggravated assault and atmospheric lead level over time in 6 US cities as leaded petrol was phased out. And this supports previous work showing that lead and possibly other heavy metals contribute to violent crime and social disruption. Source control is obviously the critical and most difficult step in managing these outbreaks. And then the chelating agents of choice in lead are calcium disodium EDTA, which is an IV agent, and dimacaptosuccinic acid, DMSA, an oral agent which is less toxic derivative of dimacaprol, a British anti-leucide that's historically been used. We also provide supplements of other divalent cations that might be chelated out accidentally, such as iron and zinc and calcium. Now, mercury exists in a complex biotransformation pathway whereby it moves between the 3 forms of organic, inorganic and metallic. And the most common causing poisoning is organic, and methyl mercury is the most common of that. It's produced from inorganic mercury by microorganisms and then eaten by larger marine creatures, and finally, unfortunately, poisons the likes of Jeremy Piven here, who enjoys his sushi. Elemental is the stuff that you find in thermometers, and inorganic mercury was the cause of pink disease, which was a phenomenon in the 20th century when calomel, which is mercury 1 chloride, was added to teething powders, and kids had what is thought to be a severe hypersensitivity reaction to it, and they had pink fingers and pink toes. I've oversimplified this, but essentially organic poisoning presents predominantly with neurological symptoms, so headache, visual disturbance, tremor, seizures, ataxia, emotional lability, etc. Elemental is only absorbed inhalationally and so causes concurrent pneumonitis and ARDS. Inorganic is orally absorbed, so you get more additional GI and systemic symptoms and the same neurological symptoms as well. Treatment for mercury is 2,3-dimacapto-1-propane sulfonic acid, which is DMPS, and it's similar to DMSA. It's another derivative of BAL, but it's more mercury affinitive. Supplements and also source control, of course. Now, the Minamata disaster was in 1956 and is ongoing to this day, actually, people trying to get compensated. But methyl mercury was being poured into the sea by a local industry and was contaminating the local marine life. And these creatures were then ingested by the community, and 1784 are recorded as having died before the cause was officially recognised. Now, in arsenic, patients die predominantly of GI loss and then GI hemorrhage, so they die of shock, and with exposure frequently being a homicide or suicide attempt when it's severe acute poisoning. And chronic lower dose arsenic poisoning is more insidious but also frequently deadly. Patients present with keratosis like this, but die from cancer, both skin and internal cancers. The Bangladesh arsenic crisis is a good example of the insidiousness of heavy metal poisoning. Up to 77 million people are at risk from a tainted water table, and Amer et al. Showed that 20% of those who died in a 12,000 sample of people over 10 years died because of arsenic-related diseases. Treatment: DMSA, DMPS can also be used, supplements, supportive and source control. Thank you.